The Veterans Health Administration has an event next week. The Innovation Experience virtual series will showcase the advances in innovation, collaboration, and technology that will improve and save veterans' lives. Allison Amrhein is Director of Operations for the Veterans Health Administration Innovators Network. Allison, welcome to the program.
Hi, thank you so much for having me.
So you have an event coming up, the 2021 VHA Innovation Experience. What's the purpose of that event?
The event is to really showcase the tremendous innovative and creative work that VHA is doing to support veteran health and improve veteran care, both from the frontline employees that we support to create their own innovative solutions, to the collaborations that we participate in with academic and private sector innovative companies doing amazing things. It's all about showcasing the tremendous work that we're doing to support veterans.
So can you give me an example of some of the new technologies and innovations that either you're working on or that you'll be showcasing at the event?
Yes, absolutely. So it's interesting. And as the Innovators Network is solely focused primarily on employee innovation. So I will kind of practice what I preach here with my employee innovators and say that, technology is great if it solves the problem, right? So not every problem results in a technical solution. So a lot of what you'll see are programs and talks and demos about initiatives or things that are really program-wide, like national programs that are impacting veterans, as well as technology. We have great examples of that at iEX with in the tech space with VR, virtual reality, extended reality, clinical simulation, synthetic data, machine learning. There'll be iEX talks about these topics. Digital health and the kind of wearable space is a big area tech-wise that we're playing in. But going back to that non-tech based, you'll see a lot of talks about these programs. So like a National Human-Centered Design Initiative to reimagine veterans healthcare. The first initiative from the Center for Care and Payment Innovation called VetSmile. They feature some unique and important employee-developed innovative programs. There's also an interdisciplinary approach to infertility for SCI patients and a race-based stress and empowerment program. So it's tech and kind of program national initiatives.
Allison, I understand that you're having a Shark Tank competition at the event. Tell me about that. Is that going to be like the TV show?
It is. A lot of the work was done beforehand, and Shark Tank is really focused on the kind of promising practices that are coming out of the front line of our medical centers and the hospitals and the employees that are doing the work. And they've had these practices be successful at their site or maybe one site and another site. And now others bid to have support brought into their site to replicate it locally for them. So it's very much so. Last year, Mark Cuban gave us a special shout out and had a special video for us to encourage the employee folks. It's a really fun event, and it will be great in this virtual format.
So tell me what the VHA innovation ecosystem is. What's the process for cultivating new ideas and then bringing them all the way into implementation?
Yeah, so it's focused on two primary portfolios, the Innovators Network and the Diffusion of Excellence. And the goal of the Innovators Network is to build an innovative culture, develop innovation as a competency, and to empower, the over 200,000 employees that work within the Veterans Health Administration. And so with that and kind of revolutionizing the behaviors and habits of the employees and the way that they're allowed to think and the way that they're allowed to solve problems and experiment with small scale solutions, that really starts the ball rolling. And then it moves on to these creative kind of starting prototypes and ideas. And then once they're fleshed out, they go hopefully with the playbook that the Diffusion of Excellence has created to really flush them out to see how they can be spread nationally. And then you add in the fellowship opportunities that the innovation ecosystem has, as well as a number of collaborations, our work with digital health, democratizing data, and it's a whole transformative ecosystem to really change how people think and opportunities that they have to innovate.
Can you point to some measurable successes that you've had that have actually impacted the health of veterans?
Yes. So that's an interesting question. I had a member of my team ask the other day, a new member, what does success look like? And for the Innovators Network, the innovations, these early stage prototypes that eventually evolve into more supported nationally projects, programs, initiatives, they've impacted over 2 million veterans. And that's inclusive of our Vet Techs program, appointment reminders, open slot management. We have the Pride program that has impacted the lives of LGBTQ plus veterans. And what's interesting about it is that data and numbers, obviously very typically thought of as quantitative, but the Innovators Network in the ecosystem are both interested in both the output, so these measurable, defined, the 2 million veterans impacted, and the outcome, which is about the experience and the transformation of the individuals that participate in our programming. And so these 2 million veterans that have been impacted are the result of the 800 plus employees in the Innovators Network who have participated in our programming. And the interesting thing, and the thing that I'm curious to look at in the future, is kind of the trail of the personal and professional impact on those employees from having participated in our program, and the network's exposure to a new way to solve problems, confidence, self-worth, and the opportunity to experiment and fail. So the 2 million veterans plus, tens of thousands of employees that have participated in Shark Tank and the programming of the Innovators Network, and the trainings that we provide. And I believe that the number for some of the diffusion projects is about $30 million of revenue avoided, or a cost avoidance. And that's just getting started.
All right. Well, Allison, thanks for being on the program, and good luck with the event.
Thank you so much.